Good evening, everyone. My name is Jay Burns-Horton. I use he, him pronouns, and I serve as the Director of Community Engagement at Atlanta First United Methodist Church in downtown Atlanta. We're a justice-driven faith community in the heart of the city, and we are delighted to be hosting this monkeypox informational session with the Fulton County Board of Health. Originally, this was scheduled to be done with Dr. David Holland, but something unexpected came up and he had to step away. But we have an awesome replacement for you all tonight. Joshua O'Neill serves as the Sexual Health Programs Coordinator at the Fulton County Board of Health. And he knows all things monkeypox. Before that, he worked at the AIDS Foundation in San Francisco, has his master in sexuality studies, and is very familiar with the monkeypox vaccine. I will let him take it away. We're going to be discussing first some time to discuss testing and transmission, and just general monkeypox information, and then we'll have updated vaccine information as well. And that's what we're going to do. Take it away, Joshua.
That's perfect. Thanks for the introduction, Jay. Hi, everyone. My name is Joshua. I use he, him pronouns. As was said, I support the sexual health program at the Fulton County Board of Health, which has inherited monkeypox response as of about a month and a half. So we're running a lot of the vaccine testing, our vaccine programming and testing and such. This is a pretty casual conversation, so I'm here for questions, any sort of inquiries that you have. I'm going to start just by going through what I know and trying to share with you some of the information that I feel is important to share within communities. I'm going to clarify some of the confusion that's sort of coming out in the news versus like what is the reality of what we're seeing, and then I'm talking about a little bit about our response and how you might be a part of that. So I do tend to talk quite quickly. I know a lot about monkeypox, so I'm going to say a lot of things. If I use a language that you don't understand, it's kind of clinical, let me know and I will clarify as well. So thanks for having me. Monkeypox. So the current update as of earlier today, it looked like we were just over 1,000 cases here in Georgia. That's one of the top 5 counts in the United States. So we are one of the hardest hit communities. We also, up until recently, had a lack of vaccines. As many people know, it's been tough. The CDC has a store of smallpox/monkeypox vaccines, but not enough to go around, and we're not prepared for this, though. So up until a few weeks ago, we had very small amounts of vaccine, but recently we got some pretty major vaccine stores from overseas that are helping us across the United States. And I'll get into vaccines in a second, what the vaccine is, how we're delivering it, all of that. But let's start again with monkeypox. So we're top 5 in the country. Most of the people impacted by monkeypox in Fulton County, at least, I can't speak for the other counties because I haven't seen their data, but about 70% of people who are getting monkeypox right now are African-American men. 99% of people getting monkeypox are men. Out of the 1,000 cases, 1,000 plus cases in Georgia, we've only had 8 women who got monkeypox, and they were closely connected to queer communities and these men that we're kind of referring to who are most heavily impacted. Also, over 50% of the people getting monkeypox are HIV positive. So we're trying to understand why folks with HIV are so susceptible. And I think there's several different layers to that. I think to call out first and foremost, racism and racial inequality, lack of access to services for Black and Brown folks, first and foremost, a disconnect between public health systems and communities that have a different relationship with health systems. I would also say that we also have a increased amount of people of color, Black and Brown folks that are living with HIV in the South. So they're disproportionately impacted by HIV, which means that because this is primarily amongst Black and Brown folks currently in Fulton County, that a lot of them were living with HIV as well. So, but also it could be that people that are living with HIV have some more susceptibility to outbreaks. The way that we connect our numbers and cases is from testing, right? So we know how many cases we have in Georgia based on how many people have tested, but the reality is testing is quite limited too. So we probably are undercounting to some degree. I think when people have monkeypox, it's intimidating to go outside, especially when you have sores on your face or on your body and you're seeing. So we're seeing that there's a lack of people accessing testing services, especially when they kind of have a pretty good idea of what it is that they have. And also there's limited treatments available for that. And I'll get to testing and treatment in just a second as well. So the way that monkeypox is manifests itself in the body is that it starts with kind of a rash. They look like little pimples. It's almost like the herpes simplex virus. It's where you have what looks like a little pimple. It opens up. It's a little bit pussy. Some of the liquid inside of the store is highly contagious because or infectious, has viral presence there, and so people from the time that they've been exposed in that site where they have the breakout to the time that they have sores are infectious, as well as the sores are healing. Once the sores start scabbing up, then generally speaking, they are pretty much non-infectious and would not transfer the virus once that they have scabs, and especially when the scabs or sores are starting to fall off. That's usually about a 2-week period of time that it takes from exposure to the onset of symptoms, sometimes up to 3 weeks. And it usually takes about 1 to 2 weeks, we say about 12 days for the symptoms to start and resolve themselves. If people have the vaccine, it doesn't necessarily mean that you, the vaccine is 2 doses. And what we know is the vaccine works what we call post-exposure. So if you've been exposed to monkeypox and you get the vaccine after that exposure, it will lessen your symptoms and the amount of time that you experience a breakout. So that's great. Even if people are exposed, we want to make sure that they have access to the vaccine. They say that 2 weeks after the first vaccine, you're about 45% protected, whereas 2 weeks after your second vaccine, you're about 96% protected if you're HIV positive, about a 98% effective rate if you're HIV negative. But this new vaccine is so new to us as far as monkeypox is concerned. There hasn't been a lot of trials in humans. So the reality is it's a full transparency moment, which is, it's a smallpox vaccine. It's worked really well for smallpox, but it seems to be working quite well for monkeypox as well. But not very many people have had their second dose yet. So it's hard to tell how effective the second dose is because we're just now getting to the point where we're giving second doses in Fulton County. We've only been providing vaccines for about the last 6 weeks. So we're 2 weeks into the second doses. The other things about monkeypox is it's transmitted through really intimate contact. So there's this idea, theoretically, folks are right, that it can be casual contact, that it can potentially be spread through droplets of spit, for example, that it could, linens and towels and clothing potentially could transmit monkeypox. But what we're actually seeing is a lot of fear-based messaging in the news that allows for this spectrum of risk to be talked about. But the reality that we're seeing is that people who are getting monkeypox are getting it from sex partners and from highly sexual encounters. And they're usually breakouts around the genital areas, and they're kind of focused and concentrated there. Some of them do move across the entire body, but we're seeing a lot of the monkeypox outbreaks somewhat contained within those areas. And if you cover those outbreak with clothing, then you're way less infectious, and it's a way of protecting yourself and others from monkeypox if you do have a current outbreak. Though when people do have an outbreak, we're telling them to stay contained again until their last sore falls off, which can be up to 2 weeks after they've started their symptoms. Let's see. So a couple things to keep in mind is there are some folks who are concerned about going into social spaces, playing sports with queer people, going to clubs with queer people. There's like a lot of folks who are a little hesitant to sharing spaces with other queer folks, sitting in pews, for example, or sitting in chairs, for example, of folks. And we're not seeing any casual contact spread like that. We're not seeing anything from, if people are talking about dollar bills or rubbing up against someone someone, that is not the case. Of course, if they do have a current outbreak and you rub up against them, that could be possible. I think you start to get into more, so casual contact, as far as just like these interactions with folks would be very low risk. You might get into higher risk categories for transmission if you're maybe sharing a dance floor with someone and you are hugging them or dancing with them quite intimately. That may, but if you're fully clothed, then that would limit your chances for exposure as well. Again, what we're seeing is people who are getting this through sexual contact, and I want to be really honest about that so that folks know what the risk is in terms of monkeypox. So what happens with testing is that people can only get testing if they have a current outbreak. So what they swab the sore and then they send the swab off to a clinic or to a lab, and within 24 hours you usually have your results. If you don't have an outbreak, then it's not possible that I know of to test for monkeypox in the state of Georgia. I have heard about types of tests that exist in California that are sort of a rapid type test, but I have not heard or seen much about, or have not seen those or heard much about them. So we are offering, there's very limited testing capacity too. Fulton County Board of Health is one of the locations at our clinic at 10 Park Place that offers testing. There's a couple community-based organizations that offer testing. Some of the HIV care providers are offering testing, but the reality is, like I said, the number that we have is from people who have tested positive. There's a lot of people who have had this that haven't tested. And so there's probably some folks that know what they have because of the communities that circulate in and because of their symptoms, and don't want to leave the house because of shame and stigma. Also, there's been people who present at like emergency care departments or urgent care centers or their doctors and are kind of shunned and turned around and asked to leave because people are afraid of them sitting in their seats in their lobby, or people who are in the lobby with them are afraid of touching them or getting close to them or of getting it. And providers don't know how to handle it. Though, with protective gear, it is much harder to get than COVID, for example. And we wear protective gear for COVID to prevent from COVID transmission. And so those same sort of protections would be in place and would keep people safe in those spaces as well. So testing is, again, quite difficult. We're starting to roll that out. Treatment is even more difficult. There's one treatment, it's called TPOX, and I actually know of no places locally that provide treatment for monkeypox. TPOX is a very controlled substance, and I'm not sure treatment, and I'm not sure why that is. And there's not a lot of it available, especially with as much as we're seeing across the United States. So they're saving treatment for people, especially people living with HIV, people with compromised immune systems, people who are overwhelmed by the reaction that they're getting. But generally, monkeypox is a lot like chickenpox, where it comes, it's really uncomfortable, it itches, it kind of burns, and you move through it, and after you're done with it, then you have an immunity to it that you probably won't get it again, at least not anytime soon. We say at least probably 5 years before you would get it. And once you get chickenpox is uncomfortable. So we're telling people, because treatment is not very widely available, to do some of the at-home care, calamine lotions, for example, or Vaseline, or sitz baths, for example, if you're having a breakout in the genitals or a booty area. We're talking about allergy medications to reduce the itching. Some at-home remedies feel like they're helpful for folks to get through that time period. But that's how community is really trying to show up for one another right now, is trying to give each other as much advice about ways that you can minimize the symptoms and the experience that you have, because the reality is you're kind of in quarantine, you're stuck at home with very little options for treatment, and you just kind of have to move through it. And there's a lot of discomfort. So that's testing and treatment, but I will say that we are doing a great job at vaccinating. Again, when we first got vaccines, we had not enough to go around. The first several weeks, we had only like a few thousand doses given to us for the entire state of Georgia. But as of the last time that I looked, it was like over 40,000 doses were provided to Georgia. They're on their way. They're dedicated to Georgia, I guess is the case. And I would be interested to see how many we've gotten out there, but I'm pretty sure we're at least at 10,000 doses for the metro Atlanta area so far. Fulton County Board of Health has been doing a vaccine clinic on Wednesdays, Thursdays, and Fridays all day, and several Saturdays we've done a clinic. We initially started at doing about 100 vaccines a day. Some of the pop-ups we've done 400 vaccines on a special pop-up, but now we're out about 500 vaccines a day, and we're trying to push up to about 600 to 800 vaccines each day on Wednesdays, Thursdays, Fridays, and some Saturdays. So there's a centralized link that we will put in the chat before this is over that will allow you to sign up for a vaccine. The vaccines are very limited, and we're really focusing on getting the vaccines to the people who are most impacted. So the people who have monkeypox in their sexual and social networks. And this is gay men specifically, especially when we're talking about equitable access to vaccines. We want to make sure it gets to Black and brown communities, to communities that are living with HIV, to communities who have a relationship with substances, to communities who might be in the sex work trade, to folks who are in again, social and sexual spaces where monkeypox is more prevalent. So we're not at the point where we're vaccinating women, for example. We are vaccinating transgender individuals. If transgender individuals are some trans women, trans men, gender non-binary folks, because they're part of our queer community, and their social and sexual networks overlap with gay men considerably. And so we want to ensure that it's somewhat contained. Out of the 8 women that were have tested positive, there were connections to queer communities and to other communities that are were maybe known by those folks, maybe not known by those folks. But I think that as soon as we get the concentration or the saturation down within this queer community and the demand starts coming down, then we will start branching out to care providers, to people who in professional arenas that could come across monkeypox, for example, and people whose social networks there's monkeypox, regardless of what your gender or your sexual orientation are. So we will see that soon enough, but we're just not there yet. So for example, we had 800 slots this week available for our vaccine clinic, and they filled up in less than 5 minutes. So there's a lot of people who are really asking us, how do we get these vaccines? And so if we have a limited amount, then we need to really concentrate on getting them directly to the people who are impacted the most as quickly as possible. A couple other things to know about the vaccines. There's 2 different types of vaccines. The smallpox vaccine is called ACAM. That's one that we're not really using. It's not good for people living with HIV. It's a live virus in the arm. Some people who have had the smallpox vaccine, especially as a kid, that will probably not protect you. It may reduce the symptoms that you have because you have somewhat of an immunity built up. So if you were exposed to it, you might have less symptoms for a less amount of time. But generally speaking, if you haven't had a smallpox vaccine in the last 5 years, it's probably not very strong. So that's a common question. And ACAM, that vaccine is not one we're using. We're using this vaccine called Jynneos, and Jynneos is not like the live version of it. The way that it's been administered so far is in the back of the arm. And then we realized that we can use a little bit less of that dose and inject it like a TB reading. So here in your forearm, just underneath the skin, it creates that little bubble like when you're doing a TB test that generally goes away within a few hours. And that's the way we're administering the vaccines now. So 1 vial of vaccine that is for the back of the arm, we can get 4 doses or 4 doses out of that same vial. So that allows us to actually expand the amount of vaccine that we're getting to community considerably, because we're still having vaccine shortages all across the United States. Best ways to get a hold of the vaccine is that each board of health is responsible for their own vaccine distribution. Hold on just one second. I have pups that are very excited, so I'm going to put in some earphones. Can you hear me okay? Perfect. So the vaccines, the best way to get vaccines is the boards of health for Gwinnett, Cobb County, DeKalb County, and Fulton County, we each get a shipment every week that we have less than 72 hours to get out into arms, right? So we know we can place an order on a Tuesday, and by Wednesday, Thursday, and Friday, we're getting them out. We will set up links. So the best thing to do is follow people. There's a link that will take you to a centralized page for the State Department of Health, that you can sign up for a vaccine in any of those counties, and it'll show you whatever appointments are available. And we release appointments on that link every week, as well as through our social media. So if you're following our Instagram, our Twitter, or Facebook for Fulton County Board of Health, again, Gwinnett, Cobb, DeKalb, all the Metro Atlanta, Clayton even, you will see updates of links for registration for their events. So Gwinnett last weekend did a drive-through and did 2,000 people and a drive-through similar to what we were doing for COVID. DeKalb is helping partner with some of the community-based clinics to get them out. And we're running our own clinic at the Neighborhood Union Health Center in Vine City area. We're not doing drop-ins now. It's registration only. The other way to get access to links is we're working closely with community-based organizations that are serving communities hardest hit to ensure that the people who are their clients have access. You shouldn't have to have a social media account in order to get access to a vaccine. And so these are folks that are working, people that may be marginally housed, that have a relationship with substances that's overwhelming, living with HIV. Again, all the folks that I'm talking about that experience health disparities are the ones most impacted, and they're often connected to service providers and care providers that can help get them frontline access. That's part of the way that we're driving equity to ensure that this vaccine is not just the registration for the open community, but also really centering the folks that are hardest hit and ensuring that they have equal access. So that's what I know about. I can probably keep going, but I'm going to stop for questions. I'm going to stop for responses, for feedback, anything that folks in the room have, so that I can serve as a resource for you all.
Yeah,
and Jay, if I missed anything.
Thank you so much, Joshua. I will ask one first question, and feel free, you can either unmute and ask a question, or you can put your question in the chat and I can ask that to Joshua, or Joshua can read it and ask it as well. But feel free to ask any questions you have. The first question I'll just ask is general, is what would be helpful as community members for the Fulton County Board of Health for us to do in response to monkeypox? Like what is an action item besides, I guess, encourage people to get vaccinated, and what information is helpful for people you're finding?
Good question. So I have dreams of putting QR codes up in spiritual spaces so people can get a direct link to a vaccine appointment. Folks that maybe aren't really associated with service providers, folks that aren't necessarily connected with medical care and clinical care. That way they can scan it at their spiritual space and they can get an appointment that day. So the link that's in the chat, if we can attach a QR code to that, that would be amazing, right? The other thing is to have honest conversations about it, right? There's people in your spiritual communities that are queer and or trans and impacted by monkeypox, and I think that we tend to close ourselves off about our sexuality, let alone about like things like monkeypox, which feels so stigmatized. And to reduce the stigma of it, and to recognize that it's just something that's occurring right now, and the chances of us coming across it are high because of who we are and who we love. And so if you're normalizing it to some degree, I think people will be more open about their experiences with it. I would guarantee that several of your communities have had folks that have monkeypox, and those folks are often in quarantine, again, for up to 2 weeks. So if there's ways that you could care for them in terms of making sure that they have home remedies and access the information that they need, the resources that they need to advocate for them, that would be great. And to squash any of the gossip and the other things that are happening outside of that, because all of us are hearing of ways that our coworkers and our families are talking about like what we're going through, and you might be sort of participating in a conversation where you're hearing someone talk about it, and it does feel dirty, it does feel hard, it does feel uncomfortable for us, especially if we have it. And so that's how people are talking about it, even within our community. And I'm trying to squash those conversations when they come up. So those are just advocacy, showing up hard for people that are impacted, and connecting to vaccines are 3 things that would be pretty major.
That's awesome. Annie asked, I have read that there is respiratory transmission. What is the risk of daily activities? Any precautions? I know somebody asked me before too. I'll add to that question, Annie. Great question. About yoga mats at the gym
Yeah,
or
gyms for sure. So there's a lot of concerns about mats. Again, yoga mats, gym equipment, and even chairs that you're sitting in. We have not seen any transmission casually like that. And if that was the case, it wouldn't be so heavily concentrated in queer communities. So I have, again, that's part of the news is around all the ways the CDC, the people who are responsible want to make sure that everybody knows all of the ways that this can travel just so people are informed. But the reality is they're not telling how this is actually happening and most likely to occur, which is sexual contact. So I would even feel comfortable hugging folks. I don't feel uncomfortable with that, but if that feels uncomfortable for you, it might be a good time for fist bumps and potentially for high fives or for, elbows, the same way we're trying to avoid COVID, right? But I have not heard of anyone getting it from respiratory drops. What I have heard is you can have sores in your mouth and saliva would carry some of the viral material. So kissing, especially deep kissing and sexual activity involving the mouth, yes, that would transmit monkeypox, even if you didn't necessarily have sores on your body. So that would potentially be a concern if someone was exposed. But thanks for the question, Annie, and I hope that I answered it.
There's another anonymous question. This may go a little bit also with that, but small children have been exposed when someone carried by someone with the pox.
So I would say this, that definitely when you hear of someone who's been potentially exposed, then we do post-exposure vaccines to minimize the impact of potential monkeypox exposure and infection for those individuals. So if you do hear of someone who is exposed or there's families, individuals that are connected, we should have a real conversation about what that exposure was and then offer a response according to what that exposure was. There are kids that were that did get monkeypox, and there's actually pets that are getting monkeypox from their owners. It's a thing that is going to happen. But what we don't know about those situations, the same as like what I can't really share about like women, for example, in the state of Georgia who got monkeypox. Is we don't know much about their family environment, right? Do they have gay dads? And if you're a gay dad who is caring for a kid, of course you're going to have a lot of exposure to young people. We don't know if maybe they had a gay uncle who was helping taking care of them, or what sort of encounters that they had with people who are again the most impacted by this. So I think that there's a lot of unknowns, and we're also like not on top of, because it's so new, we're still trying to figure it out. But I have not heard of any kids yet in the state of Georgia that were impacted by monkeypox. And I would suspect that the kids who were probably had queer people in their family units, which is what I would anticipate.
Are there symptoms before sores occur?
Yeah, flu-like symptoms. So anytime that your body gets an infection, we have the same sort of symptoms. Your body heats up, it tries to build antibodies to try to fight that infection off. And so when it heats up, you get headache, you get fever, you get sore throat, your lymph nodes are swollen, especially lymph nodes around the genitals, and night sweats, fatigue is a part of that. Sore muscles and muscle aches are a part of that too. And that would probably occur after your body has recognized that it's been infected. So I would say several days to a week, possibly 2 weeks after the infection, and just before the sores will start to break out.
Thank you. Any other questions?
Good evening. I actually don't have a question, but I just want to give you a compliment. Your spiel was very informative. In fact, I did have questions prepared. I'm Jay's husband.
Hey.
And you answered them before I could even get to them. I actually saw a friend who posted that he had an intradermal injection, and I didn't know why. And so you taught me that. And then my other question was about a history of smallpox vaccine. So thank you so much for your talk tonight.
You're welcome. I'm here for it. Also I'm going to leave my information in the chat so you can reach out if you have follow-up questions. As soon as we hang up this call, I'm sure something will pop up. But I've also been getting a lot of these questions, and the truth is I knew nothing about monkeypox 2 months ago. Like, this is new for all of us, and I have certainly learned a lot in the ways that I'm responsible for how we're showing up for these communities and supporting them. So, and I'm happy to share all the things I'm learning so that we can all be informed and respond accordingly.
There's another question too about are there long haul symptoms like chickenpox, like shingles from chickenpox? I can imagine too, long COVID. People talk about that as well. Are there any long symptoms?
We don't know. Monkeypox has been around for a long time, and it's been concentrated on certain communities, and it's never really been spread in this way. And it actually came to the United States, I think maybe a decade ago. I'm kind of making that timing up because I don't remember exactly. And it was very concentrated. It didn't get out to very many people. It's usually from animal to human transmission. So this isn't like the first time that this has occurred for us, but I'm sorry, I totally forgot the question. I was like going on a tangent. What was the question again?
Long-term effects.
Oh, but it's still new enough that we don't actually know the long-term effects, especially for this many individuals that are impacted worldwide. So that is a great question. I can just speak to my peers and my friends who have had it, and they seem to be doing okay post. There are a couple people, like with shingles, sometimes you get like pains, not virtual, what are you, like pains in the places where you had a shingles outbreak before. And so because viruses follow the same tracks in the bodies, like through nerve endings, it could impact nerves and you could have sensation, especially where some of the sores were. But we have no idea. At least I haven't heard of any long-term effects yet.
I know you mentioned this before. Somebody else asked about the protection with 1 shot versus 2 shots.
So here's what we know about the science. Again, so we're changing the ways that we're administering the dose. So because it works more effectively and you can use less of the dose and it's still just as effective is what we're getting from the CDC and the White House. We all, after COVID, we all have our feelings about the information we're getting from scientific systems of care. And so, this is our guidance, and we're trusting this based on the research that's available to us. But it is intradermal and it goes underneath the skin. And after 1 shot, at 2 weeks after your first shot, you're about 45-ish. The effectiveness is 45%. So it doesn't mean, like, when you try to translate that into like how that impacts you, it means that you've started to build a somewhat robust response to monkeypox that, again, would decrease the amount of symptoms you would have and the amount of time that you would have it, but wouldn't keep you from getting it altogether. Whereas 2 weeks after your second shot is 28 days after your first shot, then you have an effective rate of like 96 to 98%, which generally means that you would, if you're exposed to it, you probably wouldn't catch it because you have such a robust sort of immune response to it already built, so it can kind of fight it off before it takes hold in your system, but also that it would minimize the amount of impact that monkeypox would have in your body if you did in fact pick up that virus. And yes, testing for the testing available in Georgia, you cannot test unless you have an active outbreak with sores that you have to swab. However, there is apparently a test that I've heard about from my colleagues and peers in California, though it's not FDA approved and it's not widely available and I don't actually know if it's blood-based or saliva-based. I don't really know a lot about the testing technology, but it sounds like they're coming up with new testing options for folks, regardless of whether you have symptoms or not.
Is there a reaction to the shots?
Yeah, so when it was in the back of the arm, you would get like a sore arm and like a little bit of like sore muscles. Some people are feeling a little fatigued the next day, 2 days. The soreness actually can stay for several days when it's in the back of the arm, because today is literally the first day that we've been doing the subcutaneous, or not sub-Q is the back of the arm, intradermal is the front of the arm. Today is the first day we started doing intradermal dosing, and so I can't speak to that yet. I will be curious. I should follow up with my friends and see what they say.
We'll continue to monitor,
Yep.
Be in conversation with our lovely friends now that we're making at the Fulton County Board of Health.
Hey.
So basically you're saying that a person can't get tested until they actually have sores.
Yeah.
Yeah.
So if they just have the flu-like symptoms, they can't get tested.
Yep.
Correct.
I mean, if they have the flu-like symptoms, what we would do is kind of a sexual history with them to talk about potential exposures, who they've been with, what the timing is, and to try to identify what we might do in response to it. Chances are, by the time they have the flu-like symptoms, the sores are coming right afterwards. We might be able to give them a vaccine, but we're generally not vaccinating people that have symptoms because we don't want to overwhelm their body with the vaccine when their body is already trying to like respond to the virus itself. Because what happens with vaccines, they're activated by your body like thinking that it's been infected and trying to respond accordingly. And so to respond both to the virus and a vaccine might actually overwhelm the system.
Well, thank you so much.
No, I have a question, Jay.
Yeah,
What's
go
up?
ahead.
Earlier you said that you may be exposed by using towels or something like that with someone who has had open sores or things like that. But do you have any idea how long that virus remains active when it's exposed to things like towels or surfaces, things like that?
That's a great question. And I do not have an answer, and I'm not going to try to make one up. Here's what I do have as far as information about the virus living outside of the body, which is in colder refrigerated temperatures, virus can stay alive for, like I think it was several days even. But that's in like a laboratory type environment that's controlled, that like kind of allows for these viruses to live. Whereas usually viruses like HIV, like herpes, like hepatitis, when they're in the blood, basically by the time the blood dries, that it usually depends on the amount of virus that's in that blood and in the system. But in those like fluids that have virus in it, by the time that the fluids dry, the virus cannot really live for very long outside of the body. What we're finding is like it's people who are sleeping in the same bed as someone with monkeypox. So it could be the bedding or it could be them cuddling, right? There's definitely showering and towels that you're using that someone had monkeypox. Even if before they have an outbreak, what happens is you have viral shedding happen. So virus, when it attaches to the body, again, travels amongst the nerve endings. So usually when you get outbreaks like herpes or with monkeypox, it travels along the same nerve endings. And so you'll get the same outbreaks in the same spaces. But before you break out, there's still virus that's there in your skin. And as all skin sheds, there's a little bit of viral protein that can shed along with it. If we saw trends of that casual of transmission for monkeypox, it would not be still concentrated in queer communities, where overwhelmingly it's sexual contact.
Thank you.
You're welcome.
Thank you so much, Joshua. This has been, I'm going to echo Mickey and Lynn's comment in the chat, but it's been very reassuring for those of us that are in the LGBT community. It's been helpful learning about the vaccine information, and those that are allies and just community supporters, and trying to keep our community safe, to help us, equip us to have the most knowledgeable, most up-to-date information, and continue to live and create healthy and safe communities in the city of Atlanta and beyond. So very much appreciate it. I'll let you go. If there's any other questions as they come in, he put his email in the chat. We can put it back in. I'll put Joshua's email back in the chat. This video will also be posted after the fact on the Atlanta First YouTube page. And I'd be happy to give that to the Fulton County Board of Health, and they can do whatever they want with it as well. But thank you so much for attending, and have a great evening and a safe night. And thank you again, Joshua.
Hey, thank you. And I wanted to give everybody else in this space, like, thank you for showing up for this. Like, you didn't have to do that. And I see that there's many people that I would assume that are not a part of our community that are also showing up to get informed and to know. And just the fact that you're here and you're getting information from reliable sources and able to advocate for us and support us it means everything. So the queer community right now is really relying heavily on our allies and spiritual communities and spaces where we seek refuge. And so I just want to appreciate folks in the room also for participating in this conversation. And if you need anything, whether it's answers or resources, then don't hesitate to reach out. Thanks, everyone. Bye.